Assalamualaikum warahmatullahi wabarakatuh, and greetings to everyone. My name is Nur Nabila Insyar binti Alias, and I am representing my group from University Technology ZAHRAH for our assignment in IMR532, Management of Business Legal Record. Today, we are excited to present our project focused on the management of business and legal record at Hospital Islam ZAHRAH. This project aims to highlight the significance of effective record management in improving operational efficiency and ensuring compliance with legal standards. Before that, I would like to introduce my team members. The first one is Aina Akila binti Kamar Zaman. Next one is Nur Balkis binti Muhammad Yatim. Next one is Nur Khalida binti Hamdan, and the last one is Tengku Hashadia Zahirah binti Tengku Hasman. Together, we have collaborated to analyze the current practice and challenge in record management. I will also like to take this opportunity to express our gratitude to our lecturer, Dr. Muhammad Nizam bin Yunus, for his invaluable guidance and support throughout this project. Now, let's dive into our presentation on the management of business legal record at Hospital Islam ZAHRAH.
For the introduction, record are document digital paper that created and received in office activities that support operation. They provide evidence of an organization rule, decision and practices and may have administrative, legal and historical value. Next, the importance of record in organization is manages creation, storage and disposal of record. Ensure important documents are preserved, legal, financial and historical. Follow retention guideline for record life cycle, and the last one is disposes of non-essential records regularly and properly. The objective of the study is to analyze Hospital Islam ZAHRAH organizational structure and its relation to record management. Identify type of business and legal record maintained. Example given: contract, financial and pension file. Examine how records are created, stored, retrieved and retained and disposed. Evaluate compliance with legal framework. Assess the use of EMR scanning service and digital data protection. Recommend improvement for effective record management and healthcare information governance. The name of organization is Hospital Islam ZAHRAH, which maintain business and legal record for operation and compliance while operating as medical company. Story of HIAS. Hospital Islam ZAHRAH is a private hospital in Bangi, operating since 1997. It follows the hospital Masjid Ibadah concept, combining healthcare with Islamic values. The hospital aims to expand 12 branches nationwide, 3 offices by 2035, with over 20 million invested. A special unit is also training young professionals to support this growth. The location of HIAS is at Bandar Baru Bangi, Selangor. Here are the full address, which is 34 Jalan Medan PB1, Section 9, 43650, Bandar Baru Bangi, Selangor.
Next, for the type of organization, Hospital Islam ZAHRAH is a private Islamic hospital located in Bangi, Selangor. It is registered under Sendirian Berhad in accordance with the Companies Act 2016 and licensed by the Ministry of Health Ministry under the Private Healthcare Facilities and Services Act 1998. The hospital offers a wide range of healthcare service, including 24 hours emergency care, outpatient and inpatient service, surgical procedures, diagnostic service, and specialist consultation. One of the key features of this hospital is its commitment to Sharia compliant healthcare. This includes the use of halal certificate medicine, providing gender sensitive treatment options, and practicing Islamic finance principles in each operation. Furthermore, the hospital also places strong focus on delivering quality healthcare by ensuring patient satisfaction, maintaining operational excellence, and achieving financial sustainability. This is done through continuous investment in medical technology, staff training, and strategic planning. In addition to its healthcare service, Hospital Islam ZAHRAH actively participates in corporate social responsibility programs. These include public health screening and vaccination campaigns such as those preparing for Hajj. This initiative highlights the hospital dedication to both community well-being and ethical responsibility. In summary, Hospital Islam ZAHRAH successfully integrate modern medical practice with Islamic value to provide high-quality patient-centered care to the community.
Because they can now swiftly search for identify document without the delays. We move on to the retention and storage, governed by specific rule in order to maximize available space and guarantee that crucial documents are secure and accessible. Employ with both digital and physical storage option. Digital records are safely maintained in electronic setting, while physical documents are arranged in specific location. The next one is disposal. Records that are no longer required or have reached the end of their retention period are properly disposed, usually by shredding. Hospital Islam ZAHRAH also work with Subalipat SDN PhD, which is a reputable third-party service provider, to oversee the disposal process. And the last one is archiving and preservation. The hospital has started digitizing the record in order to improve accessibility and lessen the demand for physical storage space. The hospital has started digitizing their record, creating a strong protocol to protect record from possible threat, which is this organization also dedicate to implement this protocol to protect the record from possible threat like disaster or illegal access.
Next, I will share a SWOT analysis tailored to Hospital Islam Az-Zahrah's business and legal record management practices. So the first analysis is analysis of strength. The analysis highlights Hospital Islam Azhara's strategic approach to record classification, where they utilize hierarchical classification system that can enhance the organization and retrieval of records. Other than that, they also classified the records using a color-coded labeling system, which simplifies visual identification and reduces the chance of misfiling. Another strength highlighted is that access to records is limited to authorized staff only. It demonstrates that they are prioritizing the privacy and security of the data they store. Additionally, their records can be easily accessed by authorized staff as they utilize a digital access system that improves retrieval speed and supports remote workflows. In the aspect of disposal, Hospital Islam Azhara has established a disposal protocol that complies with legal standards. They are using a certified company services for disposal, such as shredding. Last but not least, their strength in managing records lies in having established procedures that define protocols for safe storage and handling. They also have clear archiving goals, which emphasize long term preservation and accessibility to the records. Next is analysis of weaknesses. One of the weaknesses in Hospital Islam Azhara's record management practice is its limited integration with digital systems, which can result in slow access and reduce scalability. So when it comes to digital, the system is having a slow response. It might happen at any time, even when they are in urgent of need to of in urgent need of access to the data. Other than that, since their records can only be accessed by the authorized staff only, there may be potential gaps in access control if the authorization protocols are not regularly updated with the latest or updated information or situation. Another weakness is that some of their records are likely to be at risk of physical damage, and making them vulnerable to environmental hazards or staff mishandling. And last but not least, Manual processes in archiving and preserving records may lead to uh, a risk of human error and inefficiency, often attributed to staff. Moving on to the third SWOT analysis, which is analysis of opportunities. In line with today's technology advancement, Hospital Islam Azhara should take a few opportunity to improve their way in managing their records. Firstly, they can pursue digital transformations such as AI indexing, which can enhance efficiency in record classification and retrieval. Uh, According to Ngadi, AI's ability to swiftly and precisely classify documents significantly reduces the time and resources required for this crucial task. The efficiency and accuracy of traditional manual processes are frequently in poor condition. AI lends more confidence to record keeping procedures by reducing human errors. Additionally, AI tools can be utilized for compliance monitoring and retention alerts in the disposal records aspect. Lastly, Hospital Islam Azhara could conduct staff training programs to improve compliance, reduce misclassifications, and also can enhance digital literacy in between the staffs. Uh, According to Widjaya, these informative sessions provide a space for the staff to understand the system better. And for the last analysis of SWOT is analysis threats. There may be several threats that will occur against Hospital Islam Azhara in managing their records. One of the potential threats is that their physical records may face disaster risk such as fire or flood, which could damage the paper-based records without having adequate backup in the system. Moreover, it can also affect the physical archives, which often lack proper backups. So another threat is cybersecurity risk, which is from unauthorized access or system vulnerabilities. Data breaches could also happen during the disposal process, particularly in sectors such as government, healthcare, and finance. Sensitive data is a major target for breaches, unauthorized access, and data theft. It was said by the annex. Besides that, uh, another threats that can also faced by the Hospital Islam Azhara is the staff members who work remotely and had access to private patient data were particularly susceptible to data breaches. Lastly, uh, they might face system failure, which could result in digital downtime and disrupting access to the critical records.
Now I will present recommendation for Hospital Islam Azhara. The first one is implement centralized digital system. Currently, the hospital use both manual and digital records. This can cause delays and even risk of data loss. So, we recommend implementing a centralized digital system to manage all records in one place. With this system, staff can access record faster and more easily. The data will be more secure and it will reduce the chance of duplication or losing important files. In short, it improves efficiency, security, and save times. Secondly, is standardized record creation and classification. Right now, each department uses its own way to create and label records, which can cause confusion. So, the hospital should standardize all record formats using digital templates. Also, they should use metadata tagging, which means adding keywords or labels to help search and retrieve records faster. This ensures consistency, easier classification, and better data organization across all departments. Thirdly is speed up digitization and monitor disposal. Although some records are already digital, many are still in physical form. These take up space and can be damaged or lost easily. So we suggest the hospital to digitize documents faster, reduce dependence on physical files, and properly manage record disposal. They should keep a disposal log which record the type of document, method of disposal, date, and who approved it. This makes the process more secure and trackable. Next is stringent access control and staff training. Access to record must be controlled properly to protect patient privacy. So we suggest the hospital use role-based access control, RBAC. This means staff can only access records related to their job roles. At the same time, regular training sessions should be provided so staff know how to use the digital system properly, keep data safe, and follow data protection guidelines. And lastly is enhanced archiving and preservation strategy. Archiving is not just about keeping old records. It's also about keeping important documents safe for future use. So, the hospital should store records in safe digital formats like PDF. Move or migrate data regularly to avoid outdated system, and protect physical files from risks like disaster or unauthorized access. This ensures records are always available, reliable, and legally compliant. To conclude, Hospital Islam ZAHRAH already has a good system for managing records. However, to support its future growth, especially with its plan to expand nationwide, it must keep improving its record management. By upgrading to centralized digital system, improving access control, and training staff, the hospital can better protect important data, make faster and smarter decisions, and gain public trust in its service. Most importantly, good records management support the hospital's mission to offer safe, high quality, and Sharia compliant healthcare.